Hi, I'm Brooke McKeever. I own and operate ultra red light therapy in Newport Beach, and I sell the LightMD technology as well as train doctors, therapists, wellness providers, and businesses on how to use and implement this technology.
My name is Jonathan Kabbes. I'm from Effingham, Illinois. I work with a mental health clinic with children, athletes, and adults working through a variety of mental health issues. Been with LightMD for a year and a half now. We've also been doing some work with anhydrous ammonia treatments, and I've personally used the machine and the devices prior to starting to implement them within my mental health clinic. As for Lyme disease, Rocky Mountain spotted fever, kidney stones, prostate stones, and chronic pain from a bad car accident I had 6 years ago.
While EMDR is an excellent tool for clearing trauma from the body, I want to talk about how it works with LightMD to help the body reset, supporting better sleep, sharper focus, and reduced physical pain. I believe together that they can provide CHP officers with the resilience needed to stay safe, effective, and mission ready on California roads. So you're often exposed as first on the scene to motor vehicle crashes, fatalities, and high-speed pursuits. This presents a unique trauma load, repeated exposure to violent or fatal outcomes. Sometimes it can be multiple times on a single shift. While EMDR is helping to reprocess the traumatic images and memories, PBM can help the physiology downshift out of chronic hyperarousal. So calming the nervous system, taking you out of fight or flight, and putting you into that rest and relaxation mode. This can be done immediately after a traumatic call or after a shift, at the end of a shift. That's when it's done best, or anytime after. It doesn't matter how long or old the trauma is, but the sooner you can get on it and help it to process out and not be held on in the brain, the better. Long shifts also mean high vigilance for hours on end. So the circadian rhythm is disrupted from overnight and rotating shifts. So this leads to more cognitive demands, which PBM can improve that by improving oxygenation in the brain, improving mitochondrial function, which is your cellular health and cellular energy, which is also helpful in supporting sustained attention, sharper decision making, and recovery from fatigue a lot faster. So this dovetails with EMDR by ensuring the brain has the energetic capacity to integrate that reprocessing work that is so important and valuable and effective. Also, the physical wear and tear on your bodies, hours and hours in patrol cars, and then sudden high intensity exertion like foot chases, pulling people from wrecks, roadside rescues, high speed chases. All of that can lead to basically physical wear and tear with the chronic musculoskeletal strain. And our light therapy is excellent at reducing inflammation, supporting circulation, and easing that cumulative toll that sometimes is eroding on our physical health. So that makes a big difference. In addition to just overall mental health pressure, so high rates of suicide and PTSD come from this important job that you're doing. And while EMDR is evidence-based for its trauma processing, adding PBM, which there's no studies on it yet. However, we have ourselves at our clinic and Jonathan Kabbes, who you learned about also in this presentation, who is a mental health practitioner who has added this. So it has been done in cases and it has been done for years, but adding that strengthens the physiological foundation. So improving sleep, getting you into that rest and relax instead of fight or flight, calmer stress response, and a stabilized mood. This makes wellness programs more effective. And it also reduces the stigma by framing this as a performance or a recovery tool, not just a mental health treatment. I can show you it's not arduous in doing the treatment. You stick your headband here, so this can be done like hands-free operation, and you have the headband, no hands, and you can get the treatment. So this is red that I'm showing you here, but a lot of the brain stuff is near infrared, which is going to penetrate past the skull into the brain. So we can pulse it to theta, alpha, gamma frequencies and help to support EMDR and trauma processing through the brain itself. In addition, you can also use these pads on the body for any location of pain. When I'm talking about resetting the nervous system and putting you into rest and relax versus fight or flight, the pads just rest here on the core of the body. This can be done sitting up, laying down. I mean, it's very comfortable, so you can just be in a chair and do this after a shift to help recalibrate and reset the body's environment and the nervous system. So staying under this constant pressure and staying healthy, that's imperative to a long, healthy career. So any way that we can support that with ultra red light or LightMD technology, we're happy to do so. Thank you for your service, and onward with Deb.
So I encourage anyone that is interested in implementing and bringing this treatment into their office as an adjunctive treatment to mental health therapy, TBIs, brain concussions. Definitely look up Light Academy, get in touch with them, and get the process rolling. It's an awesome adventure.